And thank you for everyone coming out this evening. So for the next 45 minutes or so, I hope to try and give you an understanding of what really is important when we talk about nutrition and heart health. And what I want to do is kind of take it in 4 stages. So I want to firstly talk about, so why is our heart so important? We probably all know, but I suppose to set the scene. And also to talk about what are the risk factors for CVD, so cardiovascular disease. And then how does our nutrition influence those risk factors? So how do they make a difference? And then at the end, hopefully sum it all up and say, okay, what can we do moving forward from this? So to set the scene, I suppose, when we look at our circulatory system, it's a vast network of organs and vessels, and it's really responsible for the flow of blood throughout our bodies. So that's what it does, and within that blood, there is of course the red blood cells that carry the oxygen throughout our bodies, but also the white blood cells that are really important in our immune system. Platelets that are there that actually stop us from bleeding. So if we get a cut and we bleed, it's the platelets that stop and clot that blood for us. And also the nutrients that are really vastly important for the cells and organs of our body. So that's what it's doing, and it does that with the help of the heart, the lungs and the blood vessels. So all of those work together to pump the blood around, and it's the heart that does the major job there, in a sense that it takes the oxygenated blood from the lungs, so it's pumped down into the heart, and then this oxygenated blood is pumped by the heart out into the vast system of capillaries and cells and organs throughout our body. And it does this with the pressure. So it has to have pressure to do this, and that's what we call our blood pressure. So that's the force that causes blood to flow through the arteries, capillaries and back to the heart. And normally we should have a blood pressure of what we call 120/80 millimoles of mercury. And this is what we call our systolic and our diastolic. So there are 2 different pressures that we're measuring here. So our systolic is when our blood or our heart is contracted, so when the force is the greatest. And our diastolic is when the heart is at rest and the blood is actually flowing back into the heart. So there are 2 different types of pressure that we're measuring. Okay, so that's what our system's supposed to do, but what happens when it goes wrong? And then what do we get? We get cardiovascular disease. And cardiovascular disease is a term that's over a group of disorders. So there's lots of different disorders that come under this term. So you probably have heard of coronary heart disease. So that's really any vessels that are related to the heart themselves as coronary heart. If there's a problem with them vessels, it's the coronary heart disease it's called. Cerebral vascular disease is when it's blood vessels within our brain. Peripheral is when they're lower in our arms or our legs. You can have rheumatic heart disease, and that's to do with infection that can cause problems with the heart. Congenital is obviously when you're born with something, so if you're born with a problem with your heart. And then you have deep vein thrombosis and pulmonary embolisms, and that's to do with your veins and potential blockage in your veins. But all of them come under the term cardiovascular disease. So why is it really important that we look at this? Well, firstly, it's one of the top 10 global causes of death in 2016, so when the last statistics that we have. So if we look at this table here, we can see ischemic heart disease and stroke is one of the major amounts of death, and globally it accounts for 17.9 million deaths, so a large proportion. If we look closer to home, so if we look at Ireland, in Europe particularly it's 45% of all deaths, but in Ireland what we can see is, so if we look at the death rates from all standard causes of death, and this here graph is showing cancer, the circulatory system, ischemic heart disease and respiratory. So the different colours represent the different lines in the graph, and you can see the top line there is orange, so a circulatory system. So it is one of the major ones, and it was in 2017 still. It is dropping, that is good news, but there's still a lot we can do with it, and that's what I hope to hopefully explain in the next few slides. So what is actually cardiovascular disease? So what is going wrong within our bodies? And it's mainly caused by a blockage that prevents the blood from flowing to the heart or brain. So depending on where that vessel is, it's going to cause a problem in your heart or your brain, or maybe elsewhere as well. And the most common reason for this blockage is what we call a plaque, or a buildup of fatty deposits on the inner walls of your blood vessels. So you can see it here. Normally we should have a vessel here, very clear, but when we start to see this plaque with fatty acid deposits has infiltrated the cell wall and starts to grow, we can see that the blood vessel is narrowed. And that causes problems, and potentially problems that can cause a heart attack, again if it's in your heart, or a stroke if it's within your brain. And there are two main events that we talk about when we look at cardiovascular disease. And one is the atherosclerosis. So atherosclerosis is what we call the narrowing of the blood vessels due to the buildup of fat in the arteries. So we should see a normal artery that has a lovely flow of blood. If we see this plaque building up, atherosclerosis happening, so fatty acid or fatty deposits have infiltrated the cell wall, and in between the cell wall they've started to build up, and that starts to have a mound within the vessel, and that starts to reduce the amount of space that the blood can actually flow. Now what else can happen to that is what we call thrombosis. So that's fine, it'll reduce the amount of blood that's flowing through it, but also what can happen is that could rupture. With the blood pressure that's going through that blood vessel, potentially the cap will come off that and the fatty acid deposits will spill out into the blood vessel. And then what we see is naturally what happens is our blood, or our body stops and tries to prevent that flow, so it starts to clot. And that clot can sometimes completely block that blood vessel, and therefore the blood flow completely. So there are two events that can happen: atherosclerosis and thrombosis. So it's a fatty acid buildup, so we immediately think, where's that coming from? And we think of cholesterol. Now, cholesterol is not a bad thing. What we tend to hear it in a negative way. We actually need cholesterol within our bodies. So cholesterol is a type of fat that's essential. It's produced within our livers. It's produced from dietary fat, and it's a constituent of our cells. So it's within our cell walls we need it, and also we need it for steroid hormones. And it's carried around the body in what we call lipoproteins. But there are different types of cholesterol, and this is what you've all probably heard: the good and the bad cholesterol. And what we have is low density lipoprotein cholesterol, so LDL cholesterol, and high density lipoprotein cholesterol. So this LDL cholesterol is what we call, or we know as, the bad cholesterol, because it actually sticks into the wall in the artery. So it carries the cholesterol within the circulation, and if we have too much of that, potentially that infiltrates the cell walls within the vessel and starts to build up these plaques, and therefore that's a negative thing. Then HDL cholesterol, it's a good cholesterol because it actually benefits it, because it can take that HDL cholesterol or the LDL cholesterol away. So it mops up this LDL cholesterol, packages it up, brings it off to your liver, and we get rid of it. So it's beneficial if we have higher amounts of HDL cholesterol compared to our LDL cholesterol to prevent the risk of these plaques forming. So that's what's happening. So what about the risks? So what puts us individually at a greater risk of getting cardiovascular disease? And these are the factors here. And what we classify them into modifiable and non-modifiable risk factors. And the non-modifiable risk factors, unfortunately, we can't do much about. As we get older, wear and tear, our body, we are at an increased risk of cardiovascular disease. Our gender. Men tend to be at a higher risk of cardiovascular disease. However, after a certain age, in women, it equals out. So it's not completely for the complete period of life. There are genetic factors. So if you have a family history of it, you are at increased risk. And certain races and ethnicities, such as South Asians, Afro-Caribbeans, have a higher risk of cardiovascular disease. Unfortunately, we can't do much about those factors. But for the other ones highlighted here in green, huge amount we can do. So these are what we call modifiable risk factors, so we can change them. So just to go through them to kind of explain what's going on and why they put an increased risk. for CVD. So hypertension we talked about, so the blood pressure, we need it, it pumps the blood, it's the pressure around in our system, but what happens if it gets too high? So if it's over 140/90, that's what we classify as high or hypertension, and what it's doing is actually putting strain on our blood vessels. So like anything, that if you start to pump at a high pressure over a period of time, it's going to strain it, and it's the same for our vessels. So it makes them narrower, weaker, extra strain on the heart, so it has a negative in that regard. Smoking is another thing. Smoking is one of those things that definitely has a negative effect in relation to cardiovascular disease for all of these reasons. It will increase that blood pressure. It will decrease the amount of physical activity you can do, and we'll come back to why that's positive to actually increase it. It can increase the risk of the blood to clot. So as I said, we have that thrombosis, so we have that blood clotting, but it increases the tendency of our blood to clot as well. And decrease that HDL level, so our good cholesterol that we want higher amounts of, it can decrease that levels within our system. The best thing about this is, though, if you give up smoking, within a year, you reduce your risk of CVD to half of that of a smoker. And in 15 years' time, you're the same risk as a non-smoker. So it's never too late in relation to smoking. A positive, it'll always have a positive if you can give it up. Okay, the other is diabetes. So diabetes and cardiovascular disease are very much linked. Diabetes is a lifelong condition where you have too much sugar in your blood. So when we consume food, we absorb our glucose or our sugar, and we need to get rid of that sugar within our systems, and we need to absorb it into the cells so they can use it, which we do by the means of the hormone insulin. However, in type 2 diabetes, we have higher amounts of blood sugar within our vessels because the system isn't working as it should. And this seems to be, this higher levels of blood sugar within, or glucose within the blood, seems to actually build up or increase the risk of these build up of fatty plaques within our vessels. So that's why it has that negative effect. And those who have type 2 diabetes are 3 times more likely to develop heart disease and stroke compared to those who do not, just for that reason. Other than is physical activity, and I've put this picture of Jeremy Morris, Dr. Jeremy Morris, because it all kind of really started with him, or he was one of the first studies to look at physical activity and cardiovascular disease. And in the in the late 1940s, he had a hypothesis, or he had something that he thought there's a relationship in, and he kind of stated it's all about the stairs. It's all about the stairs in these London buses, and it was to do with that there was a difference in the rates of cardiovascular disease between the conductors versus the drivers in London transport at that time. So the drivers sat there, drove the buses around, whereas the conductors were up and down stairs, off and on, loads of physical activity. So he did the study, he looked at the rates, and it was one of the first. There was far more studies since then, but looked at and found that there was a relationship. So what's it doing? Well, physical activity will not only help you maintain a healthy body weight, and we'll come back to why that's important, but it will do that. But it'll also, if we do vigorous activity, it'll help to raise our good HDL levels, or our good cholesterol levels, which will get rid of that LDL within the system. It also improves the efficiency of the heart and reduces blood pressure. So if you don't use it, you lose it. So it's the same as the heart. So we need to use it, we need to have that exercise, so we increase that efficiency of the heart. And overall, with just physical activity, we can reduce the risk of CVD by 15 to 35%. And what's more interesting is newer research is coming out. It's not only about physical activity, so you can get your physical activity, but it's also about prolonged or uninterrupted sedentary behaviour. So for all of you sitting there, if you've sat for the majority of the day and haven't done physical activity, or sat for the majority of the day, but you've got your physical activity that you're 30 minutes in at some point, you're actually increasing the risk of CVD. So we need to be active more, and maybe that's small bouts of activity more so over the day. Obesity. So it increases your risk of cardiovascular disease because your heart has to work harder. There's more of you there. So it takes longer to pump that blood around. Also, obese or overweight people tend to have raised blood cholesterol levels, higher blood pressure, and increased risk of type 2 diabetes. So all those combination of facts will increase the risk of cardiovascular disease. Also, it depends where you have that weight. So, central obesity, or if you're apple-shaped, where if you hold your weight around your waist, has a more detrimental effect. So if you're holding it here, so there's more intra-abdominal fat here, that actually has more access to your organs. And there are certain substances that the fat cells can secrete to kind of disrupt your organs and disrupt your liver and the metabolism of how you metabolize fat. So that's a potential area that we're looking at to see whether that increases your risk of CVD. And that's why important when we look at not only at weight, we look at where that weight is stored. And so waist circumference is important. So if we're a woman, all of us here should be below 80 centimetres, looking at our waist. And if we're a man, it should be 94 centimetres. I'm not going to go too much into cholesterol. We talked about cholesterol. We talked about HDL, LDL cholesterol. They're the rates that we should be looking at. So if we get our cholesterol tested by our GP, these are the desirable ranges. So LDL and HDL. So they're opposite, the HDL and LDL. Now we also have, or we might also get our triglycerides checked, or we get our number figure back. And just to note, it's just another type of fat found in your blood. Too much in your circulation can actually increase your risk of getting heart disease and stroke as well. And that's why we look for having a lower level. So it's the same nearly as LDL. We look for the lower levels. Okay, so there are the risks and what's happening in CVD. So I suppose the next part is, so where does nutrition fit into that? And there was a paper that came out recently said that if we looked at the 2016 CVD related deaths, 52% of them were due to suboptimal diet. So there's a huge amount that we can do. And the ones that I'm going to focus on for today's kind of lecture is fat, fibre, whole grain, salt, alcohol, and vitamins and minerals. And thank you, Claire, for this slide. I've copied it from her last presentation, but I think it's important before I go into kind of talk about the evidence in relation to nutrition and heart, is to state when we look at evidence, we really need to be looking at the high quality evidence. And the high quality evidence comes from those experimental studies, the randomized controlled trials, where we've looked at a treatment and compared it to a control group. Also observational studies. But not anecdotal evidence. So this is what we're looking at here. So fat. So when we think of cholesterol and we think of the fatty plaques within our vessels, we think of dietary fat. Now first to say it's not all about dietary fat, a lot of other components, but dietary fat has a role to play. There's many types of dietary fat, and they also have different actions within the body. In a sense, we have our saturated fat, so that's coming from our dairy or meats, processed foods, and then we have our unsaturated fats. We have our monounsaturated fat and our polyunsaturated fat, and our omega-6s and our omega-3s, and they're coming from our fish, from nuts, from seeds, from vegetable oils, etc. And then we have our trans fatty acids. So when it comes to the evidence in relation to cardiovascular disease, saturated fat. If we can reduce our intakes of saturated fat, the research would say that total and LDL cholesterol, so that's overall our cholesterol will go down, our bad cholesterol, the one we want reduced, and our triglycerides as well, which has had a link with cardiovascular disease, will reduce, and therefore reduce our overall risk. So that's a good thing. So saturated fat, we need to reduce it. Well, what do we reduce it with? I think that's the question. So does what we substitute saturated fat matter? Is it the PUFAs? Is it the monos? Is it the trans? Is it carbohydrates? It does matter. So it really matters what we replace it with. So when we replace it with MUFA and PUFA, the research has said it will reduce total and LDL cholesterol, so it has a positive effect. So if we want to reduce our saturated, then we should look at reducing it and looking at the ratio between saturated MUFAs and PUFAs. Trans fatty acids, no. So trans fatty acids come from, a minor amount comes from meat and dairy sources naturally, but the majority come from processed foods. And what it does, it actually increases LDL cholesterol and decreases HDL cholesterol. So a double negative in a way for us. So definitely shouldn't be replacing it with trans fatty acids. What about carbohydrates? Well, not with refined carbohydrates. So refined carbohydrates are those your processed carbohydrates that you see. And what it does, it'll actually decrease your HDL cholesterol, reduce LDL cholesterol particle size. So particle size, if it reduces the particle size, then HDL isn't as efficient at clearing it within our system. And then potentially increases our triglycerides. So it has a negative effect. So we shouldn't be replacing it with refined carbohydrates. But not all carbohydrates are the same. What about fibre and whole grain? So fibre and whole grain are really important. So when we look at fibre and whole grain in relation to cardiovascular disease, so the prospective studies, so these aren't the top, these aren't the randomised control, they're the next level down, but they are prospective, and there's strong evidence to indicate that if we increase our intakes of whole grain and cereal fibre, we see a reduction in CVD. From the randomised control trials, what we can see is that if we look at certain types of fibre and whole grain, they have a lowering of total cholesterol, LDL cholesterol, so what we want to see, and triglycerides, and will have a lowering on overall blood pressure, so they're good. So these specific types are like oat bran, and also one that you might see advertised is these oat beet glutons. So these have been shown, they come from oat, so they're a component of oats, and the evidence has been shown to support that they do lower blood cholesterol and therefore will reduce the risk of heart disease. Now, with anything like this, if you see this in a product, it's called a health claim. With a health claim, our European Food Safety Authority has to have enough evidence to back up the claim. So they do all that work for us, and they have backed up, or they say that there's enough evidence to state that yes, a food can have this claim that if it provides 3 grams of oat beet gluten per day, then it has a beneficial effect. Also, the type and variety of fibre is important within our diets for cardiovascular disease. So some fibre types, such as some coming from whole grains and seeds, provide a substrate for the gut microbiota. So the gut microbiota is your good bacteria in your gut working away doing its job, and one of its job is to actually produce short chain fatty acids from processing carbohydrates. So it does that, and this substrates from fibre is taught to actually increase this production, and it's supposed to be advantageous because this short chain fatty acid may reduce blood cholesterol levels by inhibiting cholesterol synthesis, so it has an overall beneficial effect. Okay, what about salt and sodium? Salt and sodium, they're the same thing, but too much salt or sodium is linked to higher blood pressure, so it does have an effect on your blood pressure, which will overall increase your heart risk or your risk of heart disease and stroke. So we've talked about blood pressure and why it puts a strain. So what salt does is it increases the amount of water within our system, so it reduces the ability of our kidneys to get rid of that water, and therefore it's that water that causes that overall extra pressure within our system. So that's what salt's doing, and so prolonged, if we have extra salt in our diets, we have higher blood pressure, and that higher blood pressure over a prolonged period is putting extra strain in our blood vessels that we don't want. Alcohol, everyone's favourite. The studies would indicate that alcohol, when it comes to cardiovascular disease, different for different diseases, but when it comes to cardiovascular disease, that 1 or 2 units per day does seem to reduce cardiovascular disease risk. However, that is a 1 to 2 units per day. So we overall shouldn't have, I think it's 11 for women and 13 for men per week when we look at units. if we have too much, if we have over the amount of units, or if we binge drink, so binge drinking and having, I think, more than 6 drinks in one kind of point in time, what it can actually do is it can do the other. So it can have a negative effect on cardiovascular disease. So it increases that risk of our blood clotting again, impairs the endothelium function. So the endothelium is the cells that cover your vessels, your blood vessels. And so if we impair them, if we damage them, then the fat, the cholesterol can infiltrate the cell walls easier. It also can increase our blood pressure and increase central obesity. So potentially it does have a negative effect if we overdo it with alcohol. What about micronutrients? So antioxidants. So the antioxidants are certain vitamins that are, if we look at the observational studies, have reported an inverse association with risk of CVD. So potentially when we look at those observational, looking at people who have high amounts of these antioxidants, they see a positive effect with reducing the risk. And because of that, we did studies. And we did studies looking at supplements. And we looked at supplements to see, okay, if we have a supplement of these, so if we look at A or vitamin E and see whether they have the same beneficial effect on cardiovascular disease, it just didn't stand up. And some had more so a detrimental effect. So again, it goes back to foods versus supplements. And in this case, it's foods seem to have more of the beneficial effect because we're not just eating antioxidants when we eat our fruit or our vegetables. It's the whole point of the food is the fibre, the other nutrients that are within it that potentially are having a positive effect. There's some work looking at vitamin D, and it's shown to have a positive association with vascular health, so we should be getting enough vitamin D. That's kind of more observational at this stage. There are large-scale trials underway to explore the relationship and see what's happening, but we haven't enough evidence to back it up to say that vitamin D definitely is having an effect within cardiovascular disease risk. And the other one is folic acid when we look at the micronutrients. So folic acid supplements. So folic acid is a manufactured supplement, or when we talk about folate. And it can reduce levels of circulating homocysteine. So homocysteine is an amino acid that we find within our body, and it's coming from the breakdown of protein. And some research had suggested that it's an independent risk factor for CVD. So if we have high levels of homocysteine within our bodies, then it was having an effect on CVD. They've gone on to do trials and look at supplementation again in giving people folic acid supplements and other B vitamins to see whether it does have a beneficial. But as yet, those big trials haven't had a conclusive result from it. So it's not that we can say that we should be taking folic acid for cardiovascular disease. Another thing to mention, I suppose, is the functional foods. So you may see some of these brands in the supermarket aisles looking at saying that they can actually reduce cholesterol levels. And what they have is they have this plant sterols or stanols in them. And they're plant-derived lipids, phytosterols, which are part of the cell membrane. So they come from the plant cell membranes, and they've put them into this food to make them a functional food. So they're doing a function for us. They're a similar structure to cholesterol, and they actually do reduce the amount of cholesterol absorbed in the gut. So they actually do, and they can reduce the amount of cholesterol absorbed. And as I said before, the European, or the EFSA, the European Food Standards Agency, that looks over our health claims to make sure that when a product makes a health claim on the product that it does stand up, they have put this information out. So for these stanols and stanol esters that are being put in products, there is enough evidence to say that 0.8 grams will maintain normal blood cholesterols. It also states that they have shown to reduce overall blood cholesterol by 7 to 10% in 2 to 3 weeks if we have this amount daily. And they have gone on now to say the latest one in 2012 is that actually if we can intake 3 grams within these certain products here, that it does lower LDL cholesterol by 11.3%. So those do stand up, they do work. They have a certain amount of benefit, but only a certain amount of benefit. And I wanted to mention dairy foods because more recently dairy foods have got a bit of bad press when it comes to looking at cardiovascular disease. So dairy foods are higher in saturated fat. And I have said that saturated fat is a negative thing when it comes to cardiovascular disease. However, recent research has looked at it and has suggested that the potentially other components in dairy foods are influence the effects of saturated on the health. So we shouldn't just look at per se the amount of saturated fat within a food, we should look at the overall food. So look at the matrix effect, as it said. So to look at the overall foods and what's in that food. So more recent research is saying that we should do this, and potentially there may be a benefit of certain dairy foods, and that some other nutrients such as calcium may be beneficial. Other foods that I wanted to mention because I do see them coming up as potential are these of benefit. So soya was one. So research has looked at soya, including it in a diet low in saturated fat, and it's shown in certain studies to reduce blood cholesterol, but it's very limited evidence out there. We just don't have enough strong evidence to indicate and to say that definitely it has a beneficial effect. Eggs were one as well, so eating foods containing cholesterol. So eggs are high in cholesterol, but we only absorb a certain amount of cholesterol from our foods. The majority of our cholesterol, as I said, is made within the liver, and it's made from the saturated fats that we consume, or the other fats. So eating eggs does not really greatly affect the amount of cholesterol in your blood, so you can have an egg a day if you want. Nuts, regular consumption, because they're good in those good types of fats, your PUFAs and MUFAs, so they will improve lipid profiles and reduce cholesterol levels. So yes, they have a positive effect. So I've talked a lot about foods, but I'm very conscious of the fact that we don't eat foods, or we don't eat nutrients, we eat foods, and we eat our diet every day. So what about that? What do we do in relation to that? And there has been studies that don't just look at individual foods, they look at the overall diet. And one of the men that started this research, began back in the 1940s, a lot going on at that point in time obviously, was Ansel Keys. And he wanted to look at a study to look at the relationship with fat intake and cardiovascular disease. So he was looking at dietary fat, and he started up the 7-country study to look at it. And this was one of the main study, or one of the kind of the original studies to look at the intake of fat in the countries in relation to cardiovascular disease. I put him up as well because he was a great advocate of the Mediterranean diet. So you may have all heard of the Mediterranean diet. So him and his wife went on to produce many of cookbooks in relation to the Mediterranean diet, and he did live until he was 100. So maybe there is something to it. We do know that research shows that 10% decrease in cardiovascular disease for those that are following a Mediterranean diet. And the Mediterranean diet is very much like what the foods I've outlined earlier. So it's looking at fruit and veg, increasing fruit and veg in the diet, whole grain foods, exercise, having those fish, so that the good fats within our diet. Wine is in there, so potentially it has a potential positive effect for us. Other diets that have come into play as well is the DASH diet. So the DASH diet is Dietary Approaches to Stop Hypertension diet. Again, similar to the Mediterranean diet, it's looking at putting an emphasis on portion sizes, eating foods low in sodium and saturated, high in potassium, calcium, magnesium, fibre and protein. So looking at the vegetables, the fruits, the whole grains, etc. And they have seen positive effects in relation to cardiovascular disease looking at this diet as well. And just to say, so that was the original research by Appel et al. In 1997 when they looked at this in an American cohort, and they give 3 cohorts a different diet. One was the control, where they give them the average American diet. The second was just giving them a diet high in fruit and vegetables, but the other was DASH diet, so it was looking at low sodium, low fat dairy products, fruit and veg. And what you can see is they looked at blood pressure, so they really wanted to look at blood pressure in this diet, and we could see that systolic decreased and diastolic decreased. So we do see a complete difference at the end of the 8-week intervention, that there was an effect. And they've gone on to look at that in many studies since. What we see here a lot now is the plant-based diet, so sustainable living, etc. And it does have its positive. So if you look at a diet that is plant-based, it does show that there are a 20% lower risk of CVD from following that. And again, it's higher intakes of fruit and veg, legumes, whole grain. So it's that type of foods that we've talked about earlier that would suggest the beneficial effect. So that's in relation to food and nutrients. So what do we do now to keep our heart healthy and happy? So this is our dietary advice. So if you've ever seen this, this is a food pyramid designed by the HSE, and it would indicate very much like that. So loads of vegetables and fruits, whole grain products, a certain amount of dairy, 3 servings a day, etc. So that's really it in the sense that we should be following the food pyramid. It's not very much different than in relation to cardiovascular disease. So choose the whole grain foods, the low fat dairy, fruit and vegetables. Limit the intake of foods that are high in saturated. Choose your PUFAs and MUFAs and 2 portions of fish a week. And then moderate your salt intake and your alcohol intake. And look at labels. I found these when I was doing this lecture. These are lovely things from the Irish Heart website here, and we should be looking. So if you're ever looking at your food, you're ever in your supermarket, probably you do it already, is to look at the salt content within them. So this is the amount. We should be getting less than 6 grams per day, or 2.4 grams of sodium. So this is a handy thing to have, to look that up. And also this I found as well from the Irish Heart Foundation is food shopping card. So check how much food, salt and sugar is in your, so per 100 grams of food, this is what we should be aiming for if we're looking at foods. And overall aim for a healthy weight. So we should be trying to aim for that healthy weight. We know maintaining that healthy weight has a beneficial effect, and especially when we look at waist circumference to try and reduce that central obesity. And lastly, I suppose other lifestyle events or advice that is out there in relation to cardiovascular disease. I've talked about physical activity and sedentary behaviour, obviously really important. Smoking, very important. So if we can reduce it or stop it, we can reduce the risk. Other components that we have looked at in the literature is sleep. So if we have short duration of sleep, or really not a good quality sleep, it can actually increase our risk of cardiovascular disease. And stress, lo and behold, like the stress I was under today to get this already. But increased level of stress, especially like work stress, etc., can increase that level of cardiovascular disease risk that we see as well. So if we can reduce that. And lastly, these are some resources that hopefully may help you. So Irish Heart Foundation, Healthy Ireland, Get Highly Active. The HSE have lovely information here, and the INDI as well. And finally, just to remind you, so this is a series. So I was lucky enough to do nutrition and heart health, but we do have another one on mental health coming up as our next one on the 17th of June, and then we go on to look at childhood, so children and pregnancy in the later lectures. And also the previous lectures that are made available following this link as well, so you can look at the lectures if you weren't able to attend them. So thank you very much for listening.